I'm Anita Huberman. I'm CEO of the Surrey Board of Trade, and thank you for virtually attending the town hall today in Surrey, British Columbia. We are going to be the largest city in British Columbia very soon, and we're so pleased to have with us a very special guest, Dr. Victoria Lee, President and CEO of the Fraser Health Authority, and we'll hear from her very shortly. I'd like to acknowledge that we are on the unceded territory of the Coast Salish peoples, specifically the Kwantlen, Katzie, Semiahmoo, and Tawasin First Nations. Today's Surrey Digital Town Hall is co-hosted with the South Asian Business Association and the Surrey Board of Trade. And we've worked well together for many years on a variety of community and business initiatives. We also thank the Port of Vancouver for their sponsorship of our ongoing series of our Surrey Digital Town Halls, especially since the pandemic hit us in the middle of March. I'd like to take this opportunity to thank our frontline workers at the Port of Vancouver, our marine terminal operators, our truck drivers, our railroaders. Without them, we would not have our goods getting to market locally, nationally, and internationally. Thank you so much to the Port of Vancouver. Just a couple of instructions before we begin. The session is being recorded and the link will be sent to you after the session is over. If you have a question, please type it in the chat function of the Zoom technology and I'll get to it as soon as I can. And if I'm not able to get to it, we will respond with an answer after the session is over. I'd also like to just say a couple of things. We do have Surrey's COVID Pandemic Business Center on our website at businessinsurrey.com. So for any updates from any level of government or any business support that you need, you can find it there or contact the Surrey Board of Trade. And of course, all of our contact information is at businessinsurrey.com. And we work very actively and closely with the South Asian Business Association to ensure that we are your concierge of connections together. I'm also one of 9 business organization representatives that sit on the Premier's Economic Recovery Task Force. We meet every 2 weeks with the Premier and his fellow ministers to talk about gaps and opportunities during the pandemic and also during economic recovery. And we have a direct line right into the Prime Minister's office to do the same thing, identify those gaps and opportunities during this pandemic and for economic recovery. Now, I just wanted to also introduce our special speaker, and then she has a few words for you, and we're gonna go right into the questions because we want to hear from you. And it's very strategic to align the business community with our local health authority because the health industry sector matters to business. It matters to our local economy. Now, our keynote speaker, she joined Fraser Health in 2010 as a medical health officer. She's held many progressive leadership positions, including her most recent role as the Vice President for Population Health and Chief Medical Health Officer. Prior to joining Fraser Health, she worked in collaboration with national and international organizations, including the United Nations Development Program and the World Bank. She is responsible for the overall strategic direction and operations of the Fraser Health Authority, and Surrey is a part of the Fraser Health region. Please help me welcome the President and CEO of the Fraser Health Authority, Dr. Victoria Lee. Victoria.
Thank you so much, and good afternoon, everyone. Thank you for having me here today. It's certainly been my privilege and honor to lead Fraser Health during these challenging times, and privilege to be joining you this afternoon. As you mentioned, Fraser Health serves 1.8 million people around our region with 20 very diverse municipalities. There are 32 First Nations as well as 5 Métis chartered communities. Nearly 90% of refugees and over 40% of newcomers actually settle in our region. And as one of the 5 health authorities in BC, Fraser Health, of course, provides a wide range of health services that includes 12 acute hospitals and community-based long-term care, home health, mental health, and public health services. And as you mentioned in my background, having experienced SARS, the H1N1 pandemic, avian influenza, Ebola, and opioid overdose crisis in different roles and settings, and in the public health arena, I know that these emergencies can really test the capabilities of our health system, and at the same time test our society to reveal some of the strengths and some of the vulnerabilities as well. And I think over the past several months, the COVID-19 pandemic has really fundamentally changed our daily lives, while also uniting us and doing our part to flatten the curve. And through these extraordinary times, we've stood together and have learned a great deal along the way. And the pandemic has, I think, also prompted us to adjust how we interact with each other and work to care for our children and support our communities. And every time I've visited with our staff, medical staff in the front lines or behind the scenes, everybody's told me how the 7 p.m. cheers brought, I think, something special and sometimes tears to their eyes. And I think it's been a wonderful opportunity to see how the communities really wrapped around the health services and the people that are working in our health sector. So I like to also take the opportunity to thank the public, our foundations, and our partners such as yourselves for, I think, helping us flatten the curve together. And all of the achievements would not have been possible without your tremendous support, sacrifice, and collaboration as well. And as you mentioned, Anita, health plays a significantly important role in the overall economy. And in fact, in the communities that we are in, we're actually the largest sector in terms of the number of people that we employ as well. So we have 40,000 people in what I call our Fraser Health family, from medical staff to volunteers. So on behalf of the whole organization, certainly a pleasure to be here and looking forward to the conversation today.
Thank you so much, Victoria. You know, one of the things that is very interesting, but not surprising, is the spike in COVID-19 cases. What can we all do to contain that recent hike in recent weeks?
Yeah, I think sometimes, you know, I think that first of all, there's been tremendous amount of work done locally, provincially, and federally to ensure that we flatten the curve. And BC has done extremely well. And I think the recovery plan and reopening of our society has been careful and cautious and intentionally so. And when we look at that reopening, sometimes we lose that vigilance, because it feels as though things are back to normal, but it's really things are back. We really need to look at that as new normal, and what does the new normal look like? And the new normal still includes us ensuring that we're washing hands, we're staying home if we're ill, we're not actually touching our faces, ensuring that we're maintaining that physical distance or physical barrier or masking if that's not possible. So I think all of those things need to take into place, as well as, of course, I think one of the other things to remember is that the recent numbers of cases is a reminder that COVID-19 exists in our communities, and we still need to ensure that we're following all of the recommendations and advice from public health experts, and of course from our provincial health officer, Dr. Henry.
Victoria, can you comment on, and maybe it's not a fact anymore, but from what I've heard, Fraser Health Region has the highest number of positive COVID-19 cases. What has contributed to that, and why is that?
Yeah, that's an important question because, as you know, lots of work has been done. And I think I mentioned we serve 1.8 million people. And part of that is that we're the most populous health authority in the whole province. So we have the largest number of people. We also have mostly urban settings. So there's some urban, suburban, and some rural communities, but majority of our communities are in our urban Lower Mainland and Fraser Valley location. So we know that COVID-19 cases occur in terms of disease transmission in largely urban settings. And as of June 2020, I think end of June, we had over 50% of the cases in our region. And we've also had specific outbreaks that were large, such as some of the meat processing plants, and some that were quite unique, such as Mission Institute that had large number of cases from one outbreak. I think what's really important to highlight is that not only have we had those cases, but we've successfully investigated nearly 1,700 cases and effectively traced over 7,500 contacts and looked after about 300 patients that were hospitalized in our region with compassion, humility, and dedication of our staff and medical staff and leaders. And I think that's what's really important to emphasize. The fact that we have more cases is going to be natural because of the setting that we're in, but we've successfully been able to manage and look after patients in this very, very important pandemic. And we're very well prepared if there's another wave as well.
Victoria, we're in phase 3 of the reopening of our province. Can you provide your perspective on how businesses and can keep their employees and their customers safe?
Yeah, that's an important question as well. And doing businesses through BC's Restart Plan means rolling out a number of safety and prevention measures to slow the progression of COVID-19 and ensuring that we're protecting employees, customers, and our communities at the same time. I'm sure everyone is aware that each employer is required to have a COVID-19 safety plan that assesses the risk of exposure at their workplace. And everybody's also required to implement measures to keep their workers safe. If a formal plan is not already in place prior to operation, business operators are expected to develop it while protecting the safety of your workers. And to help develop a COVID-19 safety plan, WorkSafe BC offers information and resources for keeping workers safe, including a template for a COVID-19 safety plan. Fraser Health, as a health authority, one of the regional health authorities, also works very closely with WorkSafe BC and our municipalities as well. We will not be reviewing individual plans or approving them, but the expectation is that the employers will be developing the plans in accordance with the order of the provincial health officer, and the plans must be available at the work site. There are also inspections either by Fraser Health in some of the areas that we have regulatory oversight in, such as restaurants, or there might be some inspections through WorkSafe BC, and the safety plan or the steps taken to protect workers will also be reviewed during those times. And for Fraser Health, there's specific principles and guidelines that are available on our website as well. And it's to support and help various industries through our licensing work. And these industries include, of course, restaurants, cafes, pubs, personal service establishments, swimming pools, and outdoor playgrounds and equipment, and spray parks. And again, it's important to review those guidelines as well as industry-specific guidelines that can be found on the WorkSafe BC website to ensure that your employees and the public are safe during the recovery.
Victoria, one of the most common questions that we're getting as we're reopening the economy reopening our workplaces, welcoming visitors, is what happens if someone does get COVID-19 in the workplace? What are the tracking, tracing mechanisms?
Yeah, that's also a question that we receive quite frequently as well. So thank you for sharing that question with us, and something that, of course, I'm very familiar with. So if you're diagnosed with COVID-19, for every positive case, our health authority public health team is contacted. As soon as we get the positive result, the public health team will get in touch with you and give you instructions on how to self-isolate. And you'll be required, of course, to self-isolate for a minimum of 10 days from when your symptoms start. Also, there'll be investigation of what kind of contacts you've had during the infectious period. So that's looking at both people that would be considered casual contacts as well as close contacts. And this is the process that's called contact tracing, and sometimes what we call investigative work under public health. And this is an important tool to help prevent COVID-19 from spreading in our community. So whether it's work setting or in a family setting, all of the contacts for that positive COVID-19 individuals are then identified through that contact tracing process. For that individual with COVID-19, we call that person every day until the end of their isolation period to determine if they are cleared and can get back to work or normal duties. We also do this to ensure that they are remaining isolated during that time. The contacts that have been identified of that case are also identified and quarantined, and also told to connect with us if there's any symptoms at all, and of course tested in case they are developing COVID-19 symptoms. I think it's also important to note that some of the heroic efforts that have been taking place and are ongoing are in this very important area of case management and contact identification and investigation. During the pandemic, we ramped up staff and deployed them into this important area. I think we started with something like less than 20 people to over 270 people that were doing this work during the height of the pandemic. And as you can imagine, from people that are in various businesses, ramping up by more than 100, I think more than 10 times the number of people that we had. Took a lot of work efforts as well as communication and working closely with our partners. And there's been wonderful people that came back from retirement, people that have been trained from different areas of work, as well as students that have supported these efforts. I think I just want to make sure that I acknowledge all of those folks as well. And important to note that we also do contact tracing, given our very diverse setting that we are in our region, in multiple languages, to ensure that those who need to be contacted are clearly understanding the instructions, as well as that we can get the information about contacts very closely. And in terms of social supports during this time, we've also found that individuals that required additional supports, whether it's a basic needs or food or additional support in terms of housing, have been looked after through lots of partnerships in our communities and businesses, such as those that are calling in today. So again, want to thank you for that as well.
In the media today and even yesterday, we heard that maybe British Columbia has double the number of COVID-19 cases. People are not getting tested. What's your perspective about that? Are they wary about visiting the emergency rooms? What precautions are being taken so that people feel comfortable to get tested?
Yeah, there are two different components of that question. So I'll respond to the first component about emergency departments first, and then go into our testing strategy. So emergency departments are open and able to support patients safely for those who need emergency services. I think it's important to note that we saw reductions in non-emergency patients during the pandemic, but very little reduction in terms of emergency patients. I think in terms of the actual safeguards that are in place, or the emergency departments nowadays, when you go, it will look differently than prior to COVID-19 period. There are screeners that are at the entrance of each of our hospitals to help identify any patients at risk. Patients are provided with guidance and information, as well as even for outpatient procedures. There's quite a bit of hospital work that's done when you do enter emergency department, and if it's needed, individuals are also provided with information training on how to put on and remove any of the required personal protective equipment as well. And also it's very clear where we require additional infection prevention control measures, such as droplet and contact precautions. I know that it's been very, very challenging, but we also are continuing with restricting visitors to essential visitors only at all of our sites through controlled access points to allow staff to focus on caring for patients and residents rather than, of course, monitoring, screening visitors, as well as the number of visitors will also limit the amount of physical distancing that's possible. So that's what's in place in emergency departments to ensure that we safeguard and protect our staff, as well as patients and families that are coming into our emergency departments. In terms of testing, it's important to note that we, again, very quickly during the pandemic, expanded our testing capacity. So we had 11 testing assessment centers across our region, across all of major areas of focus. We ramped up testing quite a bit in terms of number of tests, but also have seen consistent number of tests that are being done since we've had the peak and have flattened the curve. We've been seeing, I think, much less number of tests, but I think what's reassuring is the positivity rate as well. Throughout the pandemic, we've been hovering around 1% to 2% positivity rate, which is reassuring in terms of the number of tests that are actually being done. And you've heard from the provincial health officer on this point quite a bit. The testing strategy has changed throughout the pandemic to ensure that we are reflective of the epidemiology that we're seeing. So it's become very broad in terms of guidelines for who can get tested, and all of that information is available on our website. If you have any symptoms around or concerns around COVID-19, you can get tested, of course, through any of those testing assessment centers or through your primary care physician as well.
I wanted to turn the topic over to long-term care.
Yes.
Because one of the things that we're all looking at is the future. So is long-term care going to be a possible viable option when I get older in the future? When we're returning back to the workplace, our workforce has an additional anxiety about their relatives, their grandparents being in long-term care. What is the future of long-term care from your perspective?
Yeah, I'll reflect a little bit on long-term care and our response, as well as what does the future look like. So long-term care and assisted living, for those of you that are not as familiar with the services, it serves as a critical role for people who can no longer live safely or independently at home. And of course, during the pandemic, this was an area of focus because of the vulnerability of the residents in those settings, because of the age as well as complexity of health concerns that they have, and the health and safety of our residents and their families and staff, of course, are our first priority and responsibility. That's taken very seriously. In our region, there are 203 owned and operated, contracted, and private long-term care and assisted and independent living facilities. And as of today, there have been 22 COVID-19 outbreaks in these different settings. And I think what's reassuring are a few things. One is that the outbreaks have occurred in a little over 10% of the long-term care assisted living facilities. So it's a small proportion of the facilities. And when we look at our response, it's been incredible efforts across region-wide integrated coordination from public health infection control, as well as from specialists that work in clinical services, as well as we brought in UVGI types of machines and worked very closely, of course, with contracted facilities and with people that were with the families and their loved ones as well. And you know that I think it's important to note that it's been very, very challenging times because of restrictions around visiting, as well as enhanced cleaning, as well as limitations on group activities, all of those things that make it safer in terms of limiting transmission of COVID-19 can be quite difficult for residents in those settings. Now, I think a couple of things I want to note around that is one, very early on from COVID-19, we recognized the vulnerability of that population and brought in very broad and comprehensive preventive measures to ensure that we limit transmission wherever possible, with recommendations and guidelines that are posted around cleaning, around food, around restaurants, around food, around visitors, as well as around personal protective equipment for staff. And all of those measures, I think, made a difference in limiting and preventing transmission of COVID-19 occurring in the first place. Wherever there was an outbreak, we also brought in very rapid response with SWAT teams that came in to within 24 to 48 hours put enhanced measures in to ensure that there's a safe environment for those residents and families. So you can be reassured that majority of the outbreaks that we've had, they were quite limited in terms of spread. And we were very conservative in having 2 incubation periods before we declare the outbreaks over, but quite confident in terms of our measures that were put in place to ensure that families and residents are protected. I think where I think we've heard lots from our communities is around not having visits with your loved ones, which can be really, I think, difficult and challenging, especially when your loved ones are not doing very well. So I think that on one hand, we've also tried to use virtual technologies and other mechanisms to facilitate visits wherever possible. However, we've also, with the provincial guidelines, have been now implementing measures, safeguarding measures to have some family and social visits. They are limited to maximum of 1 family member or friend at a time, but we will be reassessing how that goes for the month of July and looking at how we can move forward in August as well. So we hope that we will be able to expand this safely and also be able to limit transmission. And I think for those who have their loved ones currently in care, we know that staying away from your loved ones or having limited interaction can be very difficult. And we appreciate that you're cooperating with this request with the goal of keeping our residents and staff healthy in terms of long-term care assisted living. There's been significant policy changes that have been made, including single site and additional staff, additional supports and resources. So I think fundamentally there'll be some changes in how long-term care looks, as well as how they work. But I also think that we have done everything possible to ensure that our transmission is limited and have safeguarded our most vulnerable population in a very important way by being quite comprehensive across our measures.
Victoria, I've always seen Fraser Health be a leader, in my 27-year career here at the Surrey Board of Trade. We observed in March that it was Fraser Health that ordered gyms and fitness clubs to close first. Why was that?
Yeah, I think that's another question that was asked quite frequently. So we saw some cases of transmission due to recreational or gym types of facilities in other settings. So on April 15th, Fraser Health Chief Medical Health Officer issued an order for all indoor gyms as well as fitness facilities to close. And the use of these facilities can promote the transmission of COVID-19, increasing the risk of further spread of this virus in our communities. And those closures were a necessary and I think proactive step at the time to respond to the pandemic. As you know, on May 19th, gyms and other recreational and fitness facilities were able to reopen in accordance with phase 2 of BC's restart plan with those safeguards in place. And those include posting a written COVID-19 mitigation plan and keeping that on site, as well as working alongside with WorkSafe BC to ensure that all of the safeguards are in place. So I think it was an important measure, but I'm glad that with the reopening that we're able to open those facilities where we enable physical activity in a safe manner.
The Canadian and provincial health officers have indicated that masks are not mandatory, but to be used when physical distancing cannot be maintained. Can you explain some best practices around masks? And there just seems to be a lot of confusion about when to wear a mask and when not to wear a mask.
Yeah, that's been an ongoing issue across all kinds of news channels, I think, and discussions, even scientific discussions, as well as through social media as well. So I would like to go back to what I said earlier about being one very important measure is to stay home when you're sick, washing your hands frequently and not touching your face as a first measure. And then of course, physical distancing wherever it's possible. And non-medical masks have not been shown to protect the wearers from getting COVID-19. However, it can be an additional measure you can use to protect others. And it kind of works the same way as, kind of coughing to your sleeve. So it's protecting others from droplets that you produce. So in a way, when you're in a public setting where physical distancing can be difficult, if you're grocery shopping or if you're in close and closed settings such as public transit, wearing a non-medical mask is one way to protect those around you. And I think it's also important to remember that wearing a mask that's not medical in nature. I think some people think about, well, how often do I wash and those types of things, similar to other things. If it's soiled, you should wash them. You should wash them after they feel like they're wet. Also after using it, I think during the day, it's important to clean or wash them regularly as well. So I think there's a lot of different types of non-medical masks are out there. It's not that one is better than another, but keeping in mind that wearing a non-medical mask is not a replacement for proven measures that I mentioned, like physical distancing, self-isolating when sick, and frequent hand washing.
For both the Surrey Board of Trade and the South Asian Business Association, infrastructure investments are the pathway towards economic recovery. And I'd like to know your perspective. And we've heard from BC Health Minister Adrian Dix and the Premier of British Columbia that the second hospital in Surrey is going to be built. Do you have a timeline or an update on that?
Yeah, that's been a hot topic for some time in terms of, I think that announcement about the second hospital in Surrey was welcomed by the community widely, and we were very, very excited to have a second hospital. I can share with you that we're on track to deliver on the business plan that has been shared by the minister. And we are very excited about having the second hospital in Surrey to serve the growing population. And as you mentioned, probably the largest population and community soon to be in BC as well. So certainly lots of work underway with people looking at the clinical needs that are required, as well as space needs, and we're also paying a lot of attention to how do we make this innovative. Infrastructure and capital builds are very important in terms of the community, and when it comes to health, when we make these sorts of investments, they come to life many, many years after the initial announcements are made. So we are really doing our best to work proactively and think creatively about how can we bring innovation technology into health services that we're providing in that hospital setting. So we're quite excited about that aspect as well.
The BC government a couple of weeks ago announced Surrey's second primary urgent care center, and another great investment into our city. Do you know if that site off of King George Boulevard is going to be accepting patients into family practice with the aim of continuous care? And what does success look like, in that regard?
Yeah, thank you for asking that. For both the two urgent and primary care centers, they provide urgent care services as well as attachment to ongoing primary care services. So I love to take the opportunity to clarify that, there's of course an intent to ensure that there's additional services that are available for the public instead of going to emergency department, but also the aim is to attach people to longitudinal care, to primary care teams. And the care teams are made out of multidisciplinary folks, including physicians, nurse practitioners, nurses, and we've also been able to add pharmacists and other clinical folks into that team. So the services that are available in both of those urgent and primary care centers are urgent care as well as ongoing primary care that you and your family can become attached to. And I think it's also important to note there's urgent care response center in Surrey as well for urgent mental health and substance use services. And both of these services are going to be able to navigate and connect you to broader health services as well. Because I think one of the things that I think even in health service, it can be a struggle to navigate the system. So those services can also help with navigation of health services more broadly, whether it's to home support, home health services, or to long-term care, assisted living, to mental health and substance use services.
One of the main things that I've been hearing since the pandemic, always been important, not only in the workplace, but throughout our community, is around mental health supports, physiotherapy supports, so much anxiety out there. Do you have any perspective about mental health counseling or physiotherapy services being covered under the medical services plan?
Yeah, I'll address mental health and substance use and some of the allied health services as well. One is around the fact that during COVID-19, I think one of the, it's been very, very challenging time, but it's also been rewarding in terms of being able to actually move forward in some of the areas of health service needs that we were seeing for some time. So what I mean by that, we were able to move quickly into virtual care. And mental health, many of the mental health and substance use services have become now virtual. And we heard from both patients as well as clinicians. We saw a lot less drop in the patient visits, as well as much more ongoing care that's been provided through the virtual options that have become available. I also know that for physiotherapy services, for instance, we've also made some of those services through virtual. And I think that's another advantage of looking at how do we leverage and sustain some of the positive aspects and very valuable aspects of what we've learned through the COVID-19 experience. And I think it's Winston Churchill that said, do not let a good crisis go to waste. And it's, not to I think put light to COVID-19 experience, but there's been so many learnings through COVID-19 experience. And part of that, looking at, can we expand services that's virtual, that reaches broader number of people as well as wider audiences instead of doing things the way it was done prior to COVID. That's certainly been one of the focus areas for us as well.
Well, across the street from Surrey Memorial Hospital is a very thriving health and technology district. And they're innovating around health and creating good quality jobs and entrepreneurship and thinking about the future in terms of how we deliver health. Can you provide your perspective about this new phenomena, not brand new, but new to many people, is using telehealth as a way of having care for your family?
Yeah, I have some wonderful examples, and I can start by, sharing with you that for our surgical recovery, it's been announced provincially about our very ambitious goals to go back to pre-COVID-19 levels very quickly. And part of what facilitated that for us in Fraser Health was our commitment to having that virtual care and telehealth be much more prominent in that overall work. So right now, we actually had a goal of 80% of the pre-surgical clinic and that service occurring through virtual or telehealth means. We surpassed that goal already. And we've heard wonderful stories of following up from our patients, those that might not live in our region that's in a central area, that be able to just do that pre-surgical screening and all of that work virtually instead of coming and waiting and having to go through parking, administration, and hours of that time to be seen for 30 minutes. So huge amount of efficiency gains, as well as much better, much more patient-centered care that we're able to provide through that telehealth and virtual means. So surgery has been a huge success in expanding our virtual services. Mental health and substance use services, I mentioned, has been another area. We're also looking at how we can enhance virtual services in our urgent and primary care services, and having a triage service that will be more virtual. So that's something that we're working on as well.
Victoria, I want to get your perspective about the provincial health officer, Dr. Bonnie Henry, has said that we can only have in-person gatherings up to 50 people. Yes. And, whether it's at hotels, banquet halls, golf courses, etc. And golf courses, of course, is a little bit different because you're having the event outside. What is your perspective about COVID-19? The risk, even with a smaller gathering like that, and strict adherence by the host or by the facility.
Mm-hmm.
What's your perspective on that?
Yeah, that guideline around physical distancing and the number of people I think those guidelines have been very important measures in limiting the spread of COVID-19 in our communities. And I want to also acknowledge that I've heard about, weddings as well as family gatherings, and sometimes really difficult also with funerals as well. So I know that it's been a lot of sacrifices across our families, and I know that it's been really tough to adhere to those measures. But given that we still do not have a vaccine, physical distancing and limiting the number of people that you're interacting with, as well as limiting those public events that are less than 50 people, continue to be an important part of how we cautiously reopen and recover from COVID-19.
Can you give us an update about the vaccine? We heard yesterday, from CNN that there could be a possible vaccine. It's in phase 3 of testing, but tell me your perspective about that.
Yeah, of course, herd immunity is achieved through, hopefully, I think what our aim is to achieve herd immunity through immunization, and that would be by developing a vaccine. I know that Canada, as well as many other countries, are doing incredible amount of work to accelerate what we normally see in terms of vaccine development timelines. I think it's too early to tell where we're at. I think the earliest we would see vaccines will be 2021 in terms of what timeline and how would that get implemented. There are national and provincial processes of vaccine approvals through Health Canada, as well as then, of course, public support of those vaccines in terms of resources. And then, of course, there's important work around what we do to implement those vaccines or have those immunizations occur as quickly and promptly as possible. So all of those things are, I think, under discussion as well as closely monitored. And while we're talking about vaccines, and as we, I guess it's too early to talk about fall, but since we're talking about vaccines, it's important to note that we do have a vaccine. We do have good vaccines for our annual influenza. And given where we're at with COVID-19, it'll be very important for people this fall to ensure that they're immunized against the annual influenza, because if we look at potential impacts of influenza, bad influenza season or whatnot, as well as COVID-19, the consequences could be quite great. So it would be great for the community, the public, to ensure that they're protected against influenza as another respiratory virus.
So just a sidebar question to that. So what you're saying is that as many as possible people should get an influenza vaccination. And is there going to be enough? Because we know from history that not everyone has gotten that influenza vaccination in the past.
Yeah, so the federal government, as well as the province, is doing lots of work to ensure that we actually garner more vaccines than we normally do for each season. It's very rare for us to run out of vaccines for influenza overall, but as you know, there's sometimes various reasons of not getting the vaccines. You might not need to, you're not indicated, or you might have contraindications, or you might object to having the influenza vaccine. So for multiple reasons, sometimes our influenza vaccination rates are not very high. So I think it's important, especially this season for COVID-19, for those that have recommendations to get vaccinated for influenza, really should get vaccinated.
Many members of our community have relatives, they have friends that live internationally,
Yes.
but especially for relatives that are coming back into Canada or into Surrey. Where do they go to for information about restrictions and conditions and the rules?
Yeah, the most important rule would be the national one around the Quarantine Act, and the need for you to quarantine for 14 days after you land from a different country. Now, all of those instructions and the details of that are provided when you get to the airport, but before you travel, you can go to either Public Health Agency of Canada website or Health Canada website to look at what the requirements are when you arrive in Canada. There will be quarantine officers that are at border crossings, as well as at airports that ask you some questions. You're supposed to have a quarantine plan, so your plan of how you're going to isolate for 14 days and where you're going to be staying, and your contact information as well. So all of those are requirements, and sometimes, of course, there are changes that are made to the requirements, so important to check those websites to be up to date.
My last question to you, Victoria, is what if businesses don't comply? What if they are not adhering to WorkSafe BC guidelines or Fraser Health guidelines? And I know you're working together.
Yes.
What's the consequence?
Yes. So the consequences, I'm sure many of the businesses are aware with both WorkSafe BC as well as Fraser Health. There are usually progressive disciplinary measures. Usually, it's not that businesses are intending not to comply. Usually there's some misunderstanding or not fully understanding what the guidelines are. So the first step is usually education, unless the contravention is quite grave. So if the contravention is quite grave, the business can be shut down, as you saw sometimes in meat processing plants when there's a public health risk to the extent that the business cannot be operating any longer. Some of those businesses can be closed for those reasons, but for most areas, it's usually in that progressive disciplinary action. So education, check in again to see whether those changes that have been recommended have been made, and then there might be tickets, there might be fines, as well as potential would be being closed.
Do you ever have any closing words?
Well, thank you for the opportunity to connect with you and also the members across Surrey, and I'm sure in other places. It's been wonderful to respond to some of the questions, as well as I want to acknowledge all of your contributions as community leaders and also business owners and business leaders in terms of our response to COVID-19. It's been incredibly difficult for businesses during this time, and at the same time, many of you have reached out to our staff, our medical staff, as well as our hospitals and community services to lend your help and support. And please know that those I think those gifts, whether they were just kind words to warm lunches, to I think kind and generous donations, all of those have been very much appreciated across the board. So thank you again for your role, and looking forward to continuing to work with you to ensure that we safeguard our community and our public from COVID-19 while we recover from COVID-19.
And thank you, Dr. Victoria Lee, and to the whole team at Fraser Health as our frontline workers, ensuring that when we're at home, when we were quarantined, we were doing our part. We're in this together, whether we're in healthcare, whether we're in business, whether we're a resident within Surrey, British Columbia. Thank you everyone for attending, and thank you to the South Asian Business Association and the Port of Vancouver for your support. Make it a great business day.